Hi, a very good afternoon to everyone. Welcome to our webinar. Firstly, I'd like to apologize for the issues we were facing and hence why we started late. I think we're having some problems with Facebook, so I hope those of you that are joining us on Facebook can still hear us and watch us. If not, just let us know in the comments and Dale, our IT chair, will try and sort it out. But in the meantime, I'll still forge ahead for those of you on Crowdcast. I hope everything's working fine. Okay, so a very good afternoon. I hope everyone's having a nice day so far and a fruitful week. Whether you're working from home or working at the office, I hope everyone's doing great. Thank you for joining us today. After my brief introduction, I will then, just for the flow of today, after my brief introduction, I will then hand things over to our speaker, Dr. Siva. He will then be presenting for approximately 30 to 40 minutes, during which time, please feel free to drop your questions on the Ask a Question button in the bottom right-hand corner of the screen. For those on Facebook, if you are still able to watch, please just drop a comment and we'll try and get to your questions at the end of the webinar. So Dr. Siva will present for 40 minutes and then we'll have a short Q&A session at the end. As usual, for those of you who want your CPD points, please stay till the end and fill up the form as usual. Now, let me briefly introduce our speaker for the day, Dr. Siva. Dr. Siva currently holds the position of Deputy Head Education of School, Clinical School Johor Bahru, Monash University, Malaysia. Qualified as a psychiatrist, Dr. Siva is an Associate Professor in Psychiatry at Monash University, Malaysia, and a Visiting Consultant Psychiatrist at Columbia Asia Hospital, Nusa Jaya, Johor. Dr. Sivakumar has been practicing in the field of clinical psychiatry for more than 19 years. He teaches, trains, and talks on various topics pertaining to psychiatry and psychological medicine. He is trained and specializes on the use of motivational interviewing and cognitive behavioral therapy in the clinical field. Sorry, just too many heavy words. We are extremely lucky to have him with us today, and the Johor Bahru is truly grateful to Dr. Siva for agreeing to conduct this webinar for us today. Without further ado, Dr. Siva, the floor is yours.
Thanks a lot, Anis. You can hear me well?
Yes, Dr. Siva, perfectly fine.
All right. Okay. A very good evening and wishing everyone the very best in these troubling times. Well, after a couple of years, you'll start losing count of how many years you've been in service, and I think it's the same for everyone. My apologies, Anis, for those long words. You know, when Anis approached me, and I've spoken before, and some of you may have heard, I was wondering, well, what shall we talk about? Something that's relevant, something that's more relevant to the times that we're going through. So I thought, well, let's talk about the MCO. Let's talk about COVID and how it's actually affecting. You know, the good thing is it affects all of us the same. You know, may you be a doctor, a lawyer, or even someone at home, an unemployed man, you know. I think we went through the MCO early last year. And well, for some apparent reasons, which I shall not elaborate on, we are back to square one, back to MCO, which brings to mind, you know, what effect has it got? Now you hear a lot of things that's going on, and one of the more pertinent things that people talk about is, you know, the question whether social distancing, you know, or MCO, is equivalent to mental isolation. And if so, you know, we've heard of cases going up. How does it happen? Why does it happen? You know, and what can we do about it? And that's my 30 minutes here. I may not take the entire 30 minutes. I thought we'd leave some time for Q&A. Starting off, the word connectiveness or connectivity was something that was very, very well, rarely researched on. But we know, you know, that being connected to others, you know, is something of what we call as a fundamental human need, something that humans need to survive, something human needs to be there to actually go on healthy, well-being, and other things. Now, many of us actually forget and use words wrongly. Now, there's a huge difference between the word quarantine and isolation. But you know, sometimes when we speak, we use it quite interchangeably. Now, quarantine by right is defined as the separation and restriction of people who have potentially been exposed to a contagious disease. So that's quarantine. That means if you have been in exposed with a positive person, now you're going to be quarantined. And isolation is when you actually separate people who have been diagnosed. So you don't quarantine people who have been diagnosed positive. That's isolation. So we're going to talk about both. We're going to talk about quarantine or isolation because, like it or not, even being quarantined isolates you from everyone else. Now, some of the impacts that we know of this quarantine process or isolation process is it is timeless. Sometimes the quarantine time can be long. And when I use the word quarantine here, I'm talking about just like all of us, to a certain degree, we are quarantined by the MCO. We are isolated by the MCO because we no longer can do things that we used to. And there is this fear, this infection fear that, if I walk out, if I go here, if I talk to people, will I get infected? It also brings in other concerns about being frustrated, being bored, the information that we get, like for example, no one really knows, when we actually going to get the vaccination in Malaysia. We know that, I know that colleagues in India and elsewhere have actually got theirs. And of course, the biggest thing is it's changing life and it's changing business. There's a lot of financial loss and there's a lot of stigma. So what I'm going to talk about next has got a little bit to do with all these factors. Now, some of the risk of social isolation is loneliness. Now, as I've put here, loneliness is actually defined by people's level of satisfaction, how well they are actually connected to the social network. So it could be perceived social isolation. But why is isolation so important? It's because it's very closely linked to depression, anxiety, and also a decline in the working of the brain, or what we call as cognitive decline. Now, some of the reasons for that could be because it reduces something called as resilient factors that all of us have, And when that happens, what you find is self-worth is affected, a sense of purpose basically takes the door, and people lose that feeling of being valued. Now, one may ask, well, these are all feeling of disconnection. Now, what has it got to do with depression? What has it got to do with anxiety? Now, believe me or not, all these facts are basically taken from journals which have basically published based on strong facts, research. Now, do you know that a lack of social connectivity can raise health risks as much as smoking 15 cigarettes a day? Now, we all know what cigarettes can do to us, but social disconnectivity can cause as big a damage as 15 cigarettes a day, or even having an alcohol use disorder, or even twice as harmful as obesity, and that's how loneliness impacts life. It also links to a 30% increase in the risk of stroke. What I'm trying to say is people who are consistently, pervasively lonely have got a 30% increase of stroke compared to any other individual. Social isolation also risks people in the terms of premature death. And something that came as a surprise to me when I actually researched this early when I was presenting quite early on was that there was a 40% increase in the risk of someone getting dementia just by being lonely. Now, there are very close relations to why all these things are happening. And well, although the picture there on your right-hand side or left-hand side is quite complex, what I'm going to simply explain is by just being lonely, by just being disconnected from public or from the social network, what happens is it changes things in one's body. It starts with the blood cells. And we have white blood cells, and part of the white blood cell is something called leukocyte. Now, leukocytes are basically something that is used when we have an infection, and the leukocytes are basically one of the first line defense mechanism. Now, what happens in people who are lonely, people who are alone? You find that the levels of leukocyte basically increases. increases more than anything else. And it causes an inflammation in the body. An inflammation not due to an invasion of virus or bacteria, but because of being lonely. And when inflammation goes on, inflammation has a very good documented connection with depression. And that's how body inflammation leads to depression and other mental health problems. So there's a close link between being disconnected, being lonely for a pervasive period of time with mental health illnesses. So with that, let's look at the different aspects of that has been actually affected throughout this whole year of COVID and how it's actually affected different aspects of human life. Now, US saw the largest sales of alcohol last year, that was. UK basically said that they saw a rise of about 22%, a rise of 32% that was reported in March 2020. People were drinking more. People who had not started on alcohol started. And whole new things came up, things like something called a virtual bar. And I don't know how many of you are basically aware whether, there's something called a virtual bar. I know of a virtual meeting, I know of a virtual examination, but a virtual bar, now that leaves a little to imagination. Um, what a virtual bar is, and that was actually started by Singapore, They sort of bars, because they were closed, they were forced to be closed, they sort of opened up virtual environment with songs, music, where you could actually buy your drinks first and drink later when things opened up, or when they could actually supply drinks back to you. So there was a huge increase in alcohol and in addiction when you actually look at it. Why? Now, some of the reasons that people postulated was many people who took to alcohol or took to the bottle or any other substance basically used it as a coping mechanism. What happened was many people built their coping mechanisms on social things. Like, for example, when I have a problem, when I'm stressed up, when I am troubled with things, I go talk to my friends. I go out, have a drink with them. I go to the teh tarik, a mamak shop, and those are all very external coping mechanisms. When MCO came in and when people shut those things down, they also shut coping mechanisms down. And the government didn't look at it and didn't realize it in the first place. So people were actually locked at home and did not know what to do with their problems. And voila, alcohol was a ready-made solution as a coping mechanism. Second, the postulation was that alcohol and other drugs were substituted for relationships. Now that often happens in addiction. When people are close to the environment and to public, they use alcohol. So alcohol becomes your first wife, second, third, and everything else. And that was one of the reasons. And many people actually turn to alcohol and substances to cope with stress, and that's quite common. Because of a lack of efficacy, those medications or substances help boost things up. And that's sort of explained, So there's a very close link to social isolation, the use of alcohol and other substances, and addiction problems. Now, though complex, let me just explain what it basically means. This is a research which basically looked into youngsters or adolescents who start alcohol or substances at an early age. What it showed was when you start it early, especially when you are in an isolated environment, changes in the brain causes this habit to be resistant. So in short, what I'm trying to say is, if you start your alcohol or substance use habit as an adolescent and in an isolated environment, that means with no social stimulus, you tend to get hooked on that habit, and it goes on for a longer period of time. So it makes you more vulnerable to it. And these are because of changes that takes place between chemicals and other systems in the brain. So let's leave alcohol and other substances and let's jump to psychiatric illnesses. So how has all this isolation affected people who are already ill, psychiatric patients? Well, I think that's a no gamer. Basically, most people who had a psychiatric illness fell ill again or they relapsed. So you found that a lot of people actually had anxiety problems, a lot of people had depression, and there were new people who basically developed these problems. I practice in Colombia, Asia, and I see an active group of outpatients when I am there. And I saw many of my, well, patients relapsing. I remember seeing a gentleman who was working in Singapore. And when the COVID hit us in early 2020, and Singapore closed their borders, he couldn't get in. And when he couldn't get in, he was at home and he didn't know what to do because he had he had an existing alcohol problem. And he also had a mental health problem, a bipolar illness. And work sort of became his coping mechanism. And when he couldn't work, he didn't know what exactly to do. He started drinking again. I saw another young lady. I mean, this was a sad ending to it. She was diagnosed in the wards, not a patient who walked into my clinic. She was admitted to the wards under a different colleague of mine. And she was referred to me for a mental health assessment. And what happened was she was a new mother, first-time mother, and she was living alone with her husband because of new motherhood and those experiences and the expectations. Well, she didn't have her in-laws in because they couldn't move, they couldn't travel down, and she was alone taking care of the child, and the husband was working. And she developed a lot of stress, a lot of anxiety behind it. And while she was in the wards, we basically gave her medication. She went back home, sadly only to default treatment. And she actually got worse and she attempted suicide. She strangulated herself and was brought to the emergency in a very bad condition. They transferred her to GH and she didn't make it, sadly. So we've seen, well, the good parts and, well, the worst part of things. Now, why psychiatric illness? Why is it affected so much? The same thing. People lose coping mechanisms. Even people with mental health problems develop coping mechanisms. And that's something that all of us have, Over years, they know what to do. If I'm stressed, what do I do? And when things came suddenly and then everything shut down suddenly, they lost that structure of life. And many people are just sitting at home, not doing anything, not knowing what to do. That's the worst thing, And that's when stress basically came in. When you really think of it, you don't have to have a psychiatric problem to experience some of this. And I'm quite sure that among us, many of us, when the MCO hit us smack, suddenly, we were caught. We didn't know what to do because we were basically not ready for it. Well, second time around, at least we are smarter, we are a bit more experienced, and we know what worked the last time, what did not. Now, employment hit the market, a huge impact, especially people working across the border next to us. A lot of colleagues that I know basically had problems with work. A lot of my patients lost job. And there's a close association between unemployment and suicide. It's said that suicide associated with unemployment is actually ninefold higher compared to suicide or deaths that we have actually seen during the past economic crisis. So what was postulated, what the graphs basically say is, you will not see those waves. We are most probably in our third, fourth wave of infection. And it hits us, even suicide hits us in waves. We've really not seen the worst of things. Even when it comes to a mental health illness, we've not seen the worst of things because the illness hasn't stopped. You would see the worst of things when it hits us later on down the road. This is just a very rough estimation, which was done by the labor organization, International Labor Organization. It says that the worst case scenario was a loss of 24.7 million jobs worldwide. And this resulting to an increase in suicide, this is a postulation, just an estimation, of about 9,570 per year. Now that's a huge impact. That's a huge impact on top of what we already have. So the COVID has basically, well, added on to the already heavy impact of suicide that we have. Rarely do people look into this violence, domestic violence. Surprisingly enough, domestic violence took a leap, a huge leap during the COVID pandemic. And what we noticed was there was an increasing or alarmingly increasing number of reports worldwide. Worldwide, I've just put in some in the Asian region and some overseas in the UK. What you see is what all the statistics tell you is there has been an increase in domestic violence, a huge spike. How they've estimated, the most of the estimates basically came from increased calls onto hotlines, in Malaysia, in Bangladesh, and also in England and Wales in the UK. And also admissions to the hospital and people, ladies who actually went to NGOs for help. So for um, domestic violence, it was basically a double pandemic, it's basically domestic violence and COVID together. And this was in 2020. Why? Well, the problem was the perpetrators of most of the time were husbands, lost their job, and many of them were unemployed. So they stayed at home. And when they stayed at home, what happened was many of them took to alcohol, many of them took to substances, stress increased, mental health problems increased, and there was a scarcity of resources. Women just couldn't go out during the first MCO. Things were shut down. You just couldn't go out to hospital, or you couldn't go out to an NGO to get help because most NGOs were closed and really didn't know what to do. So there was a lot of tension at home, and that sort of increased an already existing domestic violence or started new episodes of domestic violence. So that's sad. It basically affected them too. Now, how did the entire picture affect the young people, the adolescents, and the children? Now, this comes from a very early study from kids in China. And China experienced it earlier than any one of us. So some of the key factors that they sort of identified that affected mental health of the young people were concerns about their family because the family went out to work. They were also concerned to a certain degree about what's happening to them in terms of studies, education. Most kids lost routine, lost schedule. And I think that's happening even now, when kids don't get to go to school, they stay at home and they are forced to do online classes, which really doesn't work. I mean, I'm an educator myself, and I teach adults, like to say, 22, 23-year-old, and the amount of stress that we see that goes on, the amount of problems and difficulties that they have, how would you like to have a 6-year-old, 7-year-old sitting on for online classes? But that's what's happening, The main thing is they start losing that social connection when they're at home, especially families with a single child. So they found that a huge amount of them, at least 80 to 90% of the kids that they interviewed, had a deterioration in their mental health problems. What kind of deterioration? Well, among the younger kids, they saw that they were very irritable, they were very emotional, many of them were clingy. Among the more adult ones, the adolescents, they could express more. They had issues with food, eating, fatigue, sleep problems, anger, uh, nightmares, those kind of things, which basically could relate to early signs of a mental health problem. Now, the good thing about COVID, if there was any, the good thing about COVID was it didn't leave any strata of the community. It hit everyone. And so the elderly were also hit. And I would say to an extent, the elderly hit more severely because of resources. So what happened in the elderly was there was a huge impact. Some of the reasons was because many of the elderly community had coping mechanisms outside. They'd like to go for their morning walks, their tai chi and all those exercise, go and sit with a friend at the coffee shop, and that came to a halting stop, too sudden for them, and they didn't have time to build new mechanisms. And these are a group of people who are basically unemployed at home, and that impending fear when you don't get information, the only information you get is when people tell you, oh, you can't go out because you are the highest risk population. That fear of death. Met a man, it's good that some of my patients were allowed to travel when they come for patients. Now, he traveled all the way from Batu Pahat. And what happened was when the lockdown happened, it took away a lot of his resources, a lot of his coping mechanism, because he was an unemployed elderly man, but he had an active lifestyle. He used to go play badminton, and that was the hallmark of his activities, and that sort of was the main coping mechanism for his stress and everything else. So he used to have badminton games every alternate days with a group of friends. And when that stopped, he started sitting down and worrying. And he started catching every symptom that he felt, pain in the neck, difficulty in swallowing, and he develops quite severe anxiety, and that fear of, having contracted the disease came in, and unnecessary anxiety basically came in. Now, this is also, they are also a community which are most, to a certain degree, sometimes physically distancing and loneliness. So they have lower defense systems, which also brings about a lack of immunity and an easier chance of being stressed. Many of the research which looked into elderly people also looked at elderly people who were treated at institutions or institutionalized because of, or maybe even people at old folks' home. And what they found was there was a lot of marginalization that was taking place, segregation, and more so abuse. Now, this research came from early research that was published last year, came from a study from China, which looked at a whole group of elderly population, a huge group actually. They had about 1,000 plus samples with a fair share of male and female patients. And what they found was around 37.1 experienced depression and anxiety. And the elderly women more so experienced anxiety and depression compared to the men. But most people over the age of 60 expressed a higher level of emotional reaction. So it actually affected a whole range of people. So having to say that, here comes the biggest question. So how do we actually deal with loneliness and isolation during the pandemic? That's something that opens up the Pandora box and demands solutions that we've never really looked at, especially in a country where socialization is so important to us. Touching, talking, is something that comes quite automatic to us. And now that we have actually been stopped, no more shaking hands, no more touching, you just salam like this, putting on a mask, it's caused a lot of change, and it's caused a lot of impact on especially people in Malaysia, and I'm sure around the world. Structure in life is so important. What happened when the pandemic hit us was people lost structure and they changed structure. And when you change your structure in life, you change the way you do things and you lose that momentum of life. And that's something that we keep talking to people and say, don't stop the things you do it. Just do it differently. Just do it differently. So never stop things that you're doing. If you cannot go out and meet friends at a kopitiam, all right, if you've got a fixed time, let's say 10 a.m., Zoom with them, just like what we're doing now. Have a call Talk to them. So don't stop it. Just change what you're doing. A lot of people, when the lockdown took place, lost track of time. They didn't know when was day, when was night. So people just slept through the entire day. Now, don't do that, because once you do that, what happens is you lose that track of time. And what happens later on is you start losing resilience. So keep to timing. Just like a normal day, wake up as you wake up. If you're not going to office, make sure you've got a designated place, a workplace at home, and work from home just as though you're going to work. So don't stop things that you're doing. Keep the structure. Just change it. Just modify it. Resilience factor is what we said. Those are things like self-efficacy, feeling good about yourself. Now, there's a very close tie between resilient factors and coping mechanism. Now, what we need to do is we need to look at what our coping mechanisms are. In short, what are coping mechanisms? Coping mechanisms are what you do when you to overcome problems, or how do you solve your problems? How do you overcome stress? And I'm sure all of us throughout these years have actually built our own coping mechanisms. I, for one, I'm a movie buff. So I find that movies basically relax my stress. I used to, frequent the theaters a very long time ago. So I was hit badly when the theaters closed. I've changed. I've modified myself. So if I can't watch it back in the theater, let me get movies back at home and watch it over the TV. So a small example of what you can do. You've got to look, all of us have to look at how we can modify or learn new coping mechanisms, because trust me, things are not going to change. The DG has said that we're going to hit a maximum, 8,000 before anything happens. And I don't think he's very wrong. Well, I'm not too sure about the numbers, but don't expect this thing to disappear within a month or two. Well, at the looks of things, you can see how it's going. It's going to take some time. So if it doesn't change, then you've got to change. You've got to change. So build new coping mechanisms. Be ready for that. Be ready for that. Start to communicate. So if you have disconnected yourself, this is the time to actually basically start communicating, start meetings, start online classes, those kind of things. Identify stress. Identify stress. And also early signs. What do I say early signs? What I mean by early signs is if you're seeing in yourself, your family, neighbors or friends, early signs of a change, stress, depression, anxiety. Now that has to be identified early. The good part is hospitals are still open, clinics are still open, private clinics are still open, though said to be a risky area to walk into, they're still there. And many doctors nowadays do online or teleconsultation to help you identify, to help things. So much so that, the recent thing that I've heard is support groups are going online. Support groups are going online. So you have Alcoholic Anonymous and Narcotics Anonymous, basically for people with a substance use problem. They're all online now because they know there is no chance of actually meeting in groups. And that's most probably going to take some time. So deal with things, as the saying goes, if COVID gives us lemons, then let's make lemonade, all right? Modify the way you do things. So in summary, these are some things that we can do, to sort of mitigate consequences of the quarantine. Isolation only hits us hard when it is long, and most probably that was some of the early thoughts from the ministry. They tried to keep it as short as possible, as doable as possible. Information is so very important, and I think that's what they're doing a good job. You find briefings and reviews, and you also get information on your phone, about information, what's going on, what's to happen. Structure in life. Now, structure in life, I cannot stress as much as I want to, It's so important because it helps in building your resilience against infection, mental health problems, and also your coping mechanism, you know. And of course, the main thing is the communication. Keep what you're doing. Don't stop communication, because that's the start of things, you know. That's where isolation starts. That's where the disconnectivity takes place. And that sort of stops boredom and way beyond boredom. So it stops us getting worse. So, yep, I think that's my last slide, Anis. Okay, I'd like to thank you and maybe open up for any questions or any discussions that uh, would be there. Thank you.
Okay, thank you so much, Dr. Siva. That was very thorough, and I learned a lot of scientific things. But yes, thank you. Before I read the questions of other people, maybe I'll start with some of mine, if that's okay. I might use this as my own personal session. I'm kidding. Okay, but firstly, I find that um, the fact that my days are almost too similar because you're not going out, you're not meeting people, that I'm sort of losing track of my days. I don't know what happened last week because it's all the same. So sometimes I feel a bit lost. And also I feel that the fact that I can't plan for the future, there's only so much planning you can do when your life is being chopped and changed. Every 2 weeks there's new rules, and so it's impossible to plan anything, even a week or 2 weeks in advance. So what's your advice for people like me who's facing a bit of, I don't know what you call it, but I just feel like my life is just flattening out a bit.
Yeah, thanks for that. I may not have all your answers, you know, but you're not alone. You're not alone. What I think most people have described is they've lost um, this fine thin line between work, home, social. It's all one whole continuity.
Mm,
You know, many people told me that they didn't realize 2021 because it looked as though it was just 2020 ending in, you know. So you
true.
don't see those things, and that's where I came starting to talk about structure in life, you know. I know it's so easy to actually blur those lines from work to home, and you find yourself working more, you know, or vice versa. I know some people who work less, even more less, you know. So either way, to make this clear structure, and I think bosses or even employers should actually realize that, you know, just because you are working online and from home doesn't mean that you can or you should call employees after working hours,
Mm,
you know. And you know, we've got rules on that too, you know. We've got some regulations on that, though not maybe not enforced in Malaysia, but Singapore has actually taken it quite seriously after hours being called for work. So there must be a very clear segregation between work and home. So you must know when, okay, I'm going to stop, I'm going to close my laptop, put it down. And you know, the MCO still allows you, thank God for that, to go do recreational stuff by yourself.
mm,
So you can always go for a walk, you know, you can always go for a run, you can always go for a cycle. Yeah? You can't go to the gym because the gyms are all closed. Yeah, but you must do something different to see that change. If you're just going to sit at home, then you will miss it. Then it gets blurred. That's where the line blurs. So you must tell yourself, okay, I mean, example, if your working time is 5:30, you say 5:30, that's it, I'm going to close, shut everything, I'm going to go out for a walk.
mm,
So a break, do something different.
mm,
That's one. Two is never plan anything too long. You know, these are times where it's unsure times. You know, so you don't know what's going to happen. Anything can happen. So you can't plan anything for too long. Just plan it for a week, nothing more than a week. You know, and make sure that you do things which are different. Like for example, if you used to go out, you know, it may sound a bit funny and people may laugh. You know, if you used to go out over the weekends with friends to have dinner, make sure that at that same time, at that this thing, you know, you all basically zoom in and have dinner together, a Zoom
mm.
dinner, something like that. You know,
So
a lot of people have,
modify habits.
yeah, just you're just modifying it, so you're not really changing it thoroughly. You're doing things, you're meeting people, but you're the only thing is you're doing it online. You know, as much as you can. So that's the best that you can actually do. You know.
Do you highly recommend physical exercise? Do you think it's very important to help emotional, you know, feelings?
Yep, and I don't think anyone can deny that. Well, as long, I mean, physical exercise up to the level that you can,
Mm.
um, there is very strong evidence to show that it improves. It's not just the physical exercise, it's not just the oxygen, but when you physically exercise or strain yourself, there are very well documented evidences that it increases certain feel good hormones or feel good
Mm.
chemicals in your brain. Some of you may, who do a lot of reading, you may have heard things like dopamine, serotonin. It makes you, these are feel good chemicals that are released when you do good things, or when you eat, or when you go and meet friends. And exercise is one of those things. So highly recommended. Highly recommended. You don't need to leave your house.
Good. Oh, okay, let me get to a question. Someone's asking, before this, they had no anxiety in crowds, but I think because of COVID and all that, that when they go to a supermarket and it gets a bit busy, it gives them anxiety. So how do they cope with that?
All right. Now, this is someone who, from what I understand, this is someone who's never been diagnosed before and suddenly having anxiety symptoms. Um, well, it's not surprising. It's not surprising that anxiety has come up. The thing is to understand why it's come up, and that's where meeting and talking with someone, you don't need to go see a psychiatrist. Sometimes even a good trained counselor will actually do it. Understanding why it's coming, it's good. But what people will do is, when you have anxiety, is to help you deal with the anxiety. That means teach you relaxation techniques, something that you can actually do and just relax yourself, techniques to change your mindset. A lot of anxiety comes from the mind.
Mm.
It comes from the mind. It always starts with thoughts, and then it translates to emotions and anxiety. So when you're feeling scared, sad, angry, happy, always look back and ask yourself, what went through my mind? Because it will always start with a thought. And that's where talking and working with someone helps you catch those thoughts. Why does anxiety come when you are in a crowded place?
Mm.
Why suddenly? So understanding and also learning how to manage the mind, will help. So not everything needs medication. Sometimes just good proper therapy works.
Mm. Okay. Next question. To what extent or limit one should seek professional help when facing feelings of sadness, grief, or suicide? Are there telltale signs?
Sure. That's a good question. I think that's a good question. Now, feelings of sadness. Now, you've got to agree that all of us felt sad. When the first time when the lockdown came, I felt sad myself. And sadness is not depression. Okay, a lot of us use it wrongly. Okay, now when we make a diagnosis of depression, it's a clinical diagnosis, and you need to feel sadness pervasively low for at least a period of 2 weeks or more. But what's what should ring bells? Anyone can feel sad, anyone can feel anxiety, anxious, but when it starts affecting your function, now that's where bells should ring.
Mm.
Now, what do I mean by functioning? It could be occupational functioning, it could be academic functioning, it could be social functioning, it could be personal functioning. If that sadness or that anxiety stops you from working, from living a day-to-day life, a normal life with your family, or stops you from going to meet friends, now that's where bells should ring, and that's where you should go see someone. If it's not affecting functioning, then you can talk to people, you can talk. The thing is, don't keep it, voice it out. Okay, you
Mm.
have to voice it out. Now, suicide. Okay, suicide is a whole different picture. Now, a lot of people have passive thoughts of death, like, oh, I hope I sleep and I don't wake up. I
Mm.
hope God takes me. I hope I cross the road and somebody knocks me. Now that's a passive thought of death. Some people have got an active ideation, like, I'm going to do something, I'm going to hang myself, I'm going to take medication and kill myself. Now that's a different thing. But both denotes an underlying low or depressive mood, and that must be identified, and you must go see someone. So
Mm.
I'm never going to downplay suicidal thoughts or ideas, because you don't normally get suicidal ideas in a healthy person. So if you're starting to have suicidal ideas, you should go talk to someone. I'm not saying that you are depressed or anything. Sometimes severe stress can automatically elicit this kind of negative thoughts. So you need to go and talk it out. The longer you keep it, or the longer you sort of keep it to yourself, it gets worse. So it needs to be identified. So if you're seeing, or any of your colleagues, having a change in their functioning, or talking about dying, you really need to talk and get them to see someone.
Okay, thank you so much. Next question. I find that I internalize my clients' problems to the extent that it affects me emotionally. How does one overcome or separate those two things?
Right. Okay. Very deep question.
I think especially for maybe like family lawyers, where there are a lot of serious emotional things that our clients go through. So sometimes as lawyers, we feel for them. So and we get invested, you see. So
Yeah.
it's very hard to tear yourself away from that.
Right. Right. And I think it's so important to draw that line. And that's why it makes it so difficult, isn't it? Sometimes they tell that you need to show some empathy, but at the same time you also need to be professional, so that you can draw the line between client and advocate,
Mm.
or a lawyer. It's going to be very, very difficult. If it's a trend, if it's something that you've been always been doing, and if it's starting to affect yourself now, you need to go talk it out. You need to go see someone who can actually help you. It's going to be very difficult, because when you're starting to internalize clients' problems, feelings, emotions, it's eventually going to accumulate and affect your own function and your own emotions. So we normally advise people to go talk it out with someone, a counselor or someone trained in some therapy that can actually help you uh, sort of deal with those kind of things.
Okay.
There is something called interpersonal therapy, IPT, and we do have some counselors who are trained in it. It deals with the here and now, the problem that's there, that's going on, and it's highly recommended to go talk to people. Even as psychiatrists, sometimes we talk to our colleagues, so we don't try to solve our own problems. So whenever I have an issue which I feel I've started to internalize, I start talking to one of my colleagues who can basically help me deal with it.
Okay. All right. Another personal question. I'm not sure if you are, a sleep disorder person, but um, sometimes when I'm worried about my clients or worried about a case tomorrow or a decision, I tend to lose sleep. I have difficulty falling asleep at night. So next day I'm exhausted and all that. So how do you advise, how do I get that sleep, or how do I try and dissociate myself from that?
Yeah, I wouldn't say it's much of a disorder actually, Anis. Understanding the brain works like a car motor.
Mm,
You
mm,
start your car in the morning when it's cold. It starts rattling and it's a bit slow. But when you start driving, it starts heating up and the car goes well. It's just like a race car. It needs to be run first before you basically take the car out.
mm,
But at the end of the day, don't forget that at the end of the day, um, the motor that's fast needs to be slowed down. You know, the brain and the heart, they are two organs that never sleeps. If those two organs sleep, then you sleep forever. But they never sleep. So the brain needs to slow down at night. So that's
mm,
where the demarcation between sleep and wakefulness needs to be made. So let's say, I give you an example. So let's say if you're working and and let's say you get back home and you finished your food and what's so not, and let's say you plan to sleep about, let's say 10, you're planning to hit the bed about 10. Make sure that at least half an hour to an hour before that, so about 9 to 9:30, you stop everything you're doing. you stop everything you're doing, and you need to find an activity that will help calm down your brain. Now, this is called sleep hygiene. Now,
Mm.
what works for me may not work for you. So some people use, some people who are religious, they use chanting, they use hymns and prayers. Some people just like to listen to relax musical instrumental music. Some people like to read. Some people like to listen to sounds of the wave, the wind. Do a little bit of meditation, yoga, anything that works for you to sort of to calm yourself down and decentralize your thought. That means you're not thinking about work, you're back
Mm.
to yourself and relaxing. So that helps set the mood for sleep and slows down the mind.
Ah, okay. All right.
Some people
I'll
use things like essential oil,
mm,
what do you call it? Oils, those
aromatherapy. Yeah.
aromatherapy. Yeah,
Yeah.
exactly. Yeah, right.
Okay. So basically, you need to change your habits, is it?
Yes,
Or develop like a habit before you sleep
yeah.
that
Half an
that
hour,
tells your
half
brain
an
that
hour.
you want to sleep.
Right. You got to stop. You got to stop whatever you're doing, half an hour and do something different. Just distract yourself, do something relaxing
Mm,
for you.
okay. Let me check if there's other questions. One moment. Uh, if you find somebody who is showing signs of anxiety, what can you do to help that person?
Right. So if you're seeing someone who's more anxious than they usually are, I think the best thing is that you can do is to sit down and lend a hearing ear.
Mm,
A lot of people feel that, oh, I'm not. When I talk to someone, I need to talk. I need to say things, but it's actually not that. So sometimes just sitting with a person, and asking, would you like to tell me what's going on? What's your problem? Sit down and just listen. Sometimes that silence helps a lot. Sometimes the silence help a lot. And I think if you feel that the anxiety is something that's quite significant, something that's affecting functioning, you should maybe try to get some help, some professional help for the person. So if you're a trained person, it's okay. If you're not, then try not to help. The best you can do is actually send them for professional help.
okay. All right. Next question. Having a structure takes willpower, discipline. What would you advise a person who just lacks that to the point of lethargy?
Right. It happens a lot. It happens a lot. So sometimes, things like willpower and discipline is not something like an on-off switch. If your willpower and discipline comes in suddenly, then I'm suspecting something sinister. You're either on some willpower drug or some wrong substance. Sometimes it takes time. It takes a duration of time. But you can lend willpower and discipline. It can be borrowed from someone else. So this was what I had a Caucasian patient who basically exactly lost this. She was a PE teacher. She is a PE teacher, but after an injury, she stopped and then she started having problems. She didn't go back to PE. She didn't go back. She was a mountain climber. She was a runner and all those things. And she just couldn't do it. Although much of her symptoms got better, she just couldn't do it. She had that lethargy, the tiredness, and all those things. So actually got her husband in. Her husband is also an avid jogger, runner, and everything, and sort of asked him to lend her some of those motivation. Like every morning he made sure that she's up from her bed, get
Mm,
out. And sometimes that's what I tell clients. If you're setting things like a plan to go out to the gym, to go out for a jog or walk, don't do it yourself, because what happens is when you do it yourself, you set your alarm. And I know some client who set 10 alarms and they put every single one alarm off, every single alarm. So don't do that. Make an appointment with someone, go with someone. When you make that appointment with someone, eventually you're forced to, because someone is waiting for you. So it sort of forces you out. So sometimes all those initial lethargy and all those initial things need to be forced out. Eventually,
Mm.
after doing a few sessions, it gradually sets in. I've got to agree. I mean, it's easier sitting here and advising, but doing it is going to be difficult. But after your first week, the second week gets better. It's just like
Okay.
going into a gym, you know.
So basically, find support,
Find
someone that
support.
will.
Find support. Support is so important. Takes you a long way.
Okay, all right. Let me see. Last question. Because we're reaching the end. How to identify signs before it becomes an addiction, and how to help someone at the cusp of an addiction without coming across as holier than thou.
All right, right. You see, there are two aspects of addiction. One is chemical addiction. That means you're addicted to a chemical or substance like alcohol. And the other one is behavioral addiction that many of us actually forget. You know, behavioral addiction are things like gambling, internet, porn. You know, I think the hallmark of addiction is when it starts affecting function.
Mm.
When people start doing it compulsively up to an extent where they don't realize how much it's causing harm to themselves and others around them, and they can't stop. That means a level where they just don't know when to say no. A lot of people drink.
Mm.
Among those who drink, many of them know when to stop. You know, so when you lose that control, then it becomes addiction. The word dependence, carries a different meaning. The word dependence is when people start doing things repeatedly more times.
Mm.
When you stop, you start having withdrawals. That's dependence. So that's where those are the things that you basically need to watch. It's a difficult question, your second part of it, trying not to look as though you're preaching things, or
Mm.
as you have never done any wrong yourself, because whatever you say will look exactly like that to a addicted person.
Correct.
Because what happens is when I mean that's basically my interest. I'm a drug and alcohol person is not in using but dealing with people. Yeah, uh, they go into a stage of denial, and in that phase there is nothing that you can say or do that maybe will look right to them. So when you find people in that stage, I think they need an unbiased professional opinion, and that's where people need to go see uh, others. The sad part is sometimes even families of people who are addicted become get into that phase of denial,
Mm.
and they don't help, and many of them basically are enablers. They sort of keep the habit going, so if you can't get the person to see someone, get the family to go and see a doctor, and that's a starting point already. you know
Okay. All right. Thank you so much for that, Dr. Siva. Thank you so much for the presentation and answering all the questions, especially mine. I'm very appreciative. Jehovah extends our greatest appreciation to you, and we look forward to having you again when we have another webinar. Okay. For everyone else, please make sure you press the CPD button and fill up your CPD form to get your points. Jehovah is also organizing a donation drive. We are raising money to feed the needy. So if you have any means, please try and donate before the 30th of January. On that note, I think that's everything on my side. I hope everyone has a wonderful rest of the day and a wonderful week. Take care, and I'll see you at our next webinar. Thank you, everyone. Bye-bye.